Many people know John Green as their favorite fiction author who's had multiple novels made into hit Hollywood movies. His 2012 book, The Fault in Our Stars, is one of the best-selling books of all time, selling over 23 million copies by 2021. It's the story of two teenagers with cancer who fall in love. However, these fans may be surprised to discover that the success of The Fault in Our Stars wasn't an endpoint, but rather a springboard for Green's other passions.
First off, it allowed me to be more financially supportive of causes I care about, like Partners in Health, an organization that has helped Henry a lot and helped hundreds of thousands of other TB survivors. But secondly, it allowed me a lot of creative freedom. It allowed me the freedom to pursue what I want to write about and write the kinds of books I want to write. You know, The Fault in Our Stars was the book that I felt deeply compelled to write when I wrote it. And Everything is Tuberculosis is the book that I felt deeply compelled to write this time around.
Everything is Tuberculosis is the title of Green's new nonfiction book. It has a quirky title for a reason.
My wife often jokes with me that in my mind, everything is about tuberculosis and tuberculosis is about everything. And that's very true. Like history is tuberculosis, geography is tuberculosis, colonialism is tuberculosis, literature, art criticism, it's all TB. And so when I look at the world, I really do look at it through the lens of tuberculosis.
Every year, over 1 million people die of this entirely curable disease. The problem, Green says, is that in many places where TB occurs, the medicines to cure it are not available.
Because I, travel a fair amount and spend a lot of time with people living with tuberculosis, I do get tested pretty regularly, and I've never had a positive test. But, the thing is, if I do, this is a curable and preventable illness. And so if I do, I would get preventative therapy and have no problem clearing the infection from my body. This is what I find so frustrating about tuberculosis, is that someone like me can regularly access testing, can regularly access treatment if I need it. And I don't have anything to fear from tuberculosis, really. But for so many people, that's just not the case.
Such as for Green's friend, Henry Ryder, a young man with TB living in Sierra Leone, a country in West Africa.
I met Henry in 2019 when I visited Laka Government Hospital, the only TB hospital in Sierra Leone. And I was taken around the hospital by this lovely young boy who shared the same name as my son. And I was immediately charmed by him. He's extremely charismatic. He was like the mayor of that hospital. Everywhere he went, people were shaking his hand and rubbing his head. And he took me to the kitchen and took me to the lab and took me to the wards. And eventually we made our way back to the doctors I was traveling with, and they kind of shooed him away in a loving fashion. And I said, "Whose kid is that?" Because I figured he had to be the child of a healthcare worker. And the doctors explained that, in fact, he was a patient, and he was one of the patients they were very concerned about because while he was responding with the antibiotics, that's why he was able to walk around and be relatively healthy. They could tell from the test that he wasn't responding well enough and that his TB would inevitably come back.
While Henry appeared young, he was actually 17 years old. His small stature was due to malnourishment as a child, and contracting TB didn't help. The doctors were confident that his disease would return because Henry had a complicated form of drug-resistant tuberculosis.
Henry needed really a personalized, tailored treatment for just his tuberculosis. Anybody in the United States should expect to receive such personalized, tailored treatment, but in Sierra Leone, it was much harder. Henry was incredibly fortunate to have a doctor, Dr. Jérôme Tefera, who simply would not give up on him and consulted with physicians at Harvard and all around the world to try to find a drug regimen that would work for him, and then convinced the Sierra Leonean Ministry of Health to approve those drugs so that Henry could receive them.
But Henry didn't receive them. As expected, his symptoms worsened. The swollen lymph nodes in his neck and shoulder burst through his skin, leaving open wounds. Once his best friend at the hospital died, Henry believed he was next. But if proper treatments to cure the disease existed, why didn't Henry and his friend get them? Green says the life and death decision came down to one thing: money.
My friend Henry's tuberculosis cost about $900 to cure, and he was repeatedly told it wasn't cost effective to treat his TB because that $900 was simply too much money, and that it was better to focus on prevention efforts. Well, my little brother had cancer 2 years ago, and even though his cancer was very curable, it still would be more cost effective to focus on prevention efforts. We know that preventing cancer is cheaper than treating cancer, and yet nobody said to Hank, "I'm sorry, but we can't treat your cancer because it's more cost effective to prevent cancer." That's true. It is more cost effective to prevent cancer, but we should be doing both. And there's an expectation that we should provide care alongside preventative services. And I think that expectation is fair and appropriate and shouldn't only be fair and appropriate in wealthy, resourced settings.
The great news is that the Sierra Leone Ministry of Health finally did approve appropriate treatment for Henry. Within a few weeks, he recovered well enough to go home.
Henry spent years in that hospital, and those are years that he should have been in high school. He should have been able to pursue educational opportunities. He knew how important education was to someone like him, living in poverty in a low resource community. He knew how much education could make the difference for him, and he knew what it meant to lose those years. Now, because he's an extraordinary kid, he's been able to finish high school, and now he's a college student at the University of Sierra Leone studying human resources and management, and he's very successful and doing really well and about to enter his senior year. But a lot of things had to break in Henry's direction for that to be the nature of his story. He had to have a lot of support, and that should be everyone's story. Everyone who gets tuberculosis should receive the kind of care that Henry eventually received, and they shouldn't have to wait years for it.
Here in the U.S., officials document 10,000 cases of active tuberculosis every year. In 2022, 565 Americans died of TB-related causes. Still, the U.S. has some of the lowest rates of TB in the world. But while it's both curable and preventable, it continues to be a global health problem. Green argues that this is a direct result of selective awareness. Reasons include inequitable access to healthcare, late diagnosis, and non-adherence to treatment.
Developing the cure for tuberculosis is one of the most impressive things we've ever done as a species. And we did it because we, oriented all these resources around trying to develop new lines of antibiotics. And between 1945 and I think 1965, we developed 7 or 8 lines of antibiotics that can treat TB. And then between 1965 and 2012, we developed none because we just stopped being interested in it. When it ceased to be a problem in the rich world, it sort of ceased to be an area of pharmaceutical development. And that's part of the reason why we're so far behind the curve when it comes to drug resistance.
Without updated antibiotics, the new drug-resistant strains of TB are thriving. About 1/3 of international donor funding for the disease comes from USAID, which recently experienced major funding cuts and layoffs. Green says that as a result, tens of thousands of people with TB will die, and new forms of drug-resistant TB are likely to form.
We should be worried about an totally antibiotic-resistant form of tuberculosis that spreads throughout the world and becomes this terrifying superbug. But for many people, for over 1 billion people, the superbug era is already here because they don't have access to the treatments that you or I would have access to, and they don't have access to the cure. And so I think we should worry partly because we have an obligation to our fellow human beings to value all human lives the same.
Green's latest book, Everything is Tuberculosis, is available now in bookstores and online. You can find more information about John Green and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.